My name is Michelle DeVille, and I would like to discuss with you your upcoming cardiac procedures. Your doctor may have referred you for this procedure to help determine the cause of your chest pain, shortness of breath, positive stress tests, abnormal electrocardiogram, or other concerning symptoms or tests. The first test I would like to discuss is a left heart catheterization. This is the passing of a thin, flexible tube through the left side of the heart. Your doctor will determine whether the procedure is best to be performed from the groin, the wrist, or another location. Once you consent for the procedure, you will lie down on a special table in the cardiac catheterization laboratory and be draped in a sterile fashion. Your doctor will check your pulse, inject a local anesthetic into the skin to numb the area. You may feel some pressure. You may also feel discomfort as the needle is advanced into the artery. A small wire will then be moved through the needle. The needle will then be removed and a plastic tube will be passed over the wire into the artery. Through the plastic tube, we can move smaller plastic tubes called catheters up through your arteries to your heart. During this test, the cardiologist performing your procedure will advance the small plastic tube across the aortic valve into the left ventricle, the main pumping chamber of your heart, to measure the pressure within the heart. At this point, your doctor may also inject iodinated contrast dye to visualize how well the heart muscle is squeezing and pumping blood to the rest of the body. This will make you feel warm and flushed all over. We use a continuous X-ray called fluoroscopy to see the injected dye. The cardiologist will also advance small catheters to the openings of the coronary arteries, which are the arteries that supply blood and oxygen to the muscle of the heart. By injecting the contrast dye, your cardiologist will be able to see with fluoroscopy whether there are any narrowings or blockages of the coronary arteries, known as coronary artery disease. If narrowings or blockages are identified, your doctor may decide to treat you in one of several ways. The first option is to treat you with medications. The second option is to treat the narrowings or blockages by opening them with a tiny balloon and then possibly placing a stent. A coronary stent is made of a metal mesh and acts as scaffolding against the artery wall. If a coronary stent procedure is selected for treatment, a very thin wire is advanced through the catheter into the coronary artery past the narrowing or blockage. A tiny balloon is then placed over the wire and inflated inside the narrowing or blockage, opening up the vessel and allowing the normal blood flow down the coronary artery. The balloon is then removed. Another balloon with a stent mounted on it is advanced into the coronary artery at the location of the narrowing and the balloon is inflated. This opens up the stent, pressing it against the wall of the coronary artery and keeps the narrowing or blockage open. If multiple narrowings or blockages are identified or there is a significant narrowing in an artery that is difficult or dangerous to treat with stents, your cardiologist may determine that you would be best treated with coronary artery bypass surgery. This is when arteries or veins from your own body are used to bypass the narrowings or blockages in the coronary arteries. Another procedure your cardiologist may wish to perform is a right heart catheterization, in which a small catheter is advanced into the right side of the heart and arteries of the lungs. This enables us to measure the pressures in the lungs and right side of the heart. This can be performed by entering the vein in the groin, arm, or neck. Your hospital course will greatly depend on the findings during the cardiac catheterization. In some patients, no significant narrowings are identified within the coronary arteries, and the patient may be discharged the same day. In other cases, significant coronary artery disease identified during the procedure may require treatment with stents or even coronary artery bypass surgery. There are several risks to these procedures. The first risk is bleeding. The risk of bleeding is greater when accessing an artery than a vein. Following the procedure, the hole made in the artery may be closed or pressure held until the vessel seals and prevents further bleeding. Additionally, there is a risk of infection. However, this risk is very small as the access site is thoroughly cleaned, draped, and the procedure is performed using sterile technique. Another risk is that the contrast dye used during the procedure can worsen kidney function and even result in the need for dialysis. Though the risk is very low in patients with normal kidney function, this risk is increased in patients who already have reduced kidney function and diabetes. Finally, the procedure carries a very small risk of causing death, heart attack, or stroke. With diagnostic coronary angiography, the risk of causing death is approximately 1 in 1,000 patients, and the risk of causing stroke or heart attack is approximately 1 in 250 patients. While this risk is low, this is a very serious outcome, and every effort is made to avoid all adverse events in our patients. If a coronary intervention is needed with stent placement, the cumulative risk of death, heart attack, stroke, or bleeding increases by approximately 1%. Discussion with your cardiologist and nursing staff following the procedure may best help you anticipate how long you will remain at the hospital following your procedure. If the procedure is done through the groin, pressure may need to be held at your groin following removal of the plastic sheath within the artery. Strict bed rest is required to prevent the hole in the artery from opening. If you feel pain at the procedure site, in your back, or have any other significant symptoms, please do not hesitate to let your nurse or physician know. Bed rest is often recommended for about 2 to 4 hours, but may be longer. When you're ready, your nurse may supervise you walking to ensure there are no issues with bleeding at the access site. We also recommend that you do not engage in strenuous physical activity for several days following the procedure to give your artery a chance to heal properly. I would also avoid any exercise or weightlifting for at least 1 week following the procedure. After your procedure, we recommend that you follow up with your cardiologist or primary care physician to discuss the results of the procedure and to evaluate the procedure site to make sure the area has healed properly. Thank you for your attention, and please feel free to direct any further questions to your cardiologist performing the procedure.